Good morning, everyone. My name is Amber Freed, and I am the founder of SLC6A1 Connect, but more importantly, I'm the mother to the adorable twin babies you just saw on the screen. And I'm also fighting like a mother to give my son a chance at life. I'm honored to be here today and have loved the opportunity to become familiar with the KPM group and Petrosky's vision. So when this little twinado was born, they really made my life complete. I promised to love them unconditionally, be their biggest cheerleader, and to always advocate for them. But very early on, something wasn't right with Maxwell. He looked perfectly normal, but he wasn't meeting the same developmental milestones as his natural benchmark, his twin sister Riley. And mother's intuition sounds louder than a freight train. I knew something was terribly wrong, and as doctor's tone became more concerned, I became frantic. I remember thinking his movement looked like Parkinson's. So he would constantly stare at his finger, and this doesn't look like anything. Like everybody would say, oh, it's a baby who just saw his finger, but he would do this for 12 hours a day, and he would stay up all night and do this. And then the next video I have is another little boy with SLC6A1, and he had these tremors, but they look like full body chills. And he went through so many diagnoses. But all of our basic workups came back fairly normal. So because our basic workups came back normal, we went down the pathway of whole genome sequencing. Doctors prepared us and said, this is probably going to be a rare disease. Don't bother Googling, you're not going to figure it out. It took a couple of months to get the results back, and I remember the day Children's called and said, we have an answer. Come in as soon as you're available. And you know it's a really, really bad diagnosis when doctors will clear their schedule for you. My husband and I drove in, and we were led to the bad news room, a really cold, sterile room full of doctors with incredibly sad looks on their faces. And they explained to me that Maxwell had been diagnosed with SLC6A1. And I was so confused. And I said, okay, so that sounds like a flight number. What is the name of the disease? And they said, no, that is the name. It's too rare to have a name. That's the genomic location. I was totally in shock. I am frustrated, so I took out my phone and I tried to Google SLC6A1. And Google said, no search results found. Doctors started to tell me everything Maxwell was never going to be able to do, and in my mind I was just thinking of this perfect little baby at home. His life was over before it started. He was never going to enjoy all of these incredible experiences with his twin sister. What was our life going to look like? And to hear nothing could or would ever be done. I think as an output of living, everybody in this room has lived their darkest moment in life. And I can say, I can't imagine anything beating that moment for me of just watching my child's life be over in a diagnosis room like that. But it was also the moment my husband's shoulders started to shake. He was just bawling so hard. And I realized that if something was going to be done, it was going to be me. It was going to be our family. Like, nobody was going to help us. And I was going to fight like a mother. I decided to fight like the third monkey on the loading deck to Noah's Ark, and it just started to rain. I quit my dream job as the consumer equity analyst for Janus Henderson Investors that day and haven't looked back. It's been a pretty wild ride. I actually chose a career in the stock market because the stock market has this unique mechanism to remind you every single day that you're stupid. And I've found that same paradigm to exist in science. It's really bode well. I wanted nothing more than to crawl under a rock and die, and I have my entire life to do that. But Maxwell was just starting his, and I didn't have the luxury to mourn. I had to take action. So I said to myself, if you're gonna kill a cow, you best make a burger. So I called hundreds of scientists. I stayed up all night to speak with people in Asia and Australia, used Europe for the early morning, talked to people in the US during the day. And it's really hard to get a hold of smart, important people. So I did have to become a complete creeper, sending them snacks via Uber Eats until I just made it so incredibly weird that people were going to file for a restraining order or call me back. And I'm really happy to report that not a single restraining order has been filed. In fact, I've made a lot of lifelong friendships. I've seen the absolute best of humanity. So here we are 4 years later. I've raised $5 million philanthropically. Every penny has gone to help children. We've successfully repurposed an already approved FDA drug. This drug is keeping our kids stable until we can figure out next steps. We're advancing numerous novel DNA and RNA therapies that will be the closest thing to a cure our children will know in their lifetime. We're working with, or we've funded 15 academic centers. We're working with 5 biotechs directly. And my story is one of a mother's fierce love. I can do things for Maxwell that I couldn't do for myself. I'm happy to land on the moon for him. But there's a strong parallel between my story and that of many small biotechs. Most biotechs are tiny. They start with a good idea. They're eating ramen noodles, chugging Red Bull, working directly with patient organizations just like me. And I think it's really important to differentiate between the majority of small pharma and juggernauts like Merck or Pfizer. Most are small. And they're also working most closely with the patient organizations. Patient organizations bring the need, and small pharma delivers the solution. When Maxwell was diagnosed, we thought he was number 34 in the world to have SLC6A1, but this is completely misleading. The disconnect is the disease was clinically identified in 2017, so how can you be diagnosed with something that doesn't exist? Now that you can test for it, diagnoses have flooded in. We're the 10th cause of autism, the 6th cause of epilepsy, play a major role in many psychiatric disorders, and we're closely linked with Parkinson's. The story of Maxwell has transcended my little family, and we have the opportunity here to impact a multitude. The ecosystem of healthcare is equally reliant upon patient organizations, government, academia, and of course, the private sector. One of my favorite quotes is that the greatest of all action can impact a multitude, but the greatest of all intention affects only one. Small pharma is like this. Small pharma provides the vehicle to take great intention and insert the expertise to go from bench to bedside. Solving the mystery for these simple monogenic diseases like SLC6A1 will someday unlock the cure to very complex diseases like Alzheimer's. And the question we all want to answer is, how do we improve the system? This is a bipartisan problem that will require a bipartisan solution. No one here has the moral high ground. And as a community, it's incredibly important that we support the pediatric review voucher, which specifically creates economic incentives for rare diseases to become profitable. The accelerated drug approval program. Rare diseases are never going to be able to enroll 1,000 people for a lengthy 10-year trial. We're rare. We have small patient populations and typically a high mortality rate. We also have a very high unmet need. Only 5% of rare diseases actually have a treatment. We need smart drug pricing. Rare diseases carry a different set of economics, and we can't be compared to the debacle, which is the price of insulin right now. And my challenge to everyone is to support solutions, because this complex ecosystem only works if both small pharma and the Mercks and the Pfizers are doing well. I think of all of my slides, this is most important. Equity is a really important buzzword right now in society, and rightly so. But well before we are born, our genome is determined, and there's nothing we're gonna do to change it. Inevitably, some of us are going to be hit by genetic lightning. And the basis of all equity starts with health and access to healthcare. This picture is the harsh reality of rare disease. In this tiny little casket draped in the Texas flag to honor his daddy that served as a Marine for our great nation is a 3-year-old little boy named Gunnar Pittman. His mother read Goodnight Elmo at his funeral, and all of those little Elmos we collected to go to a children's hospital. Gunnar was struck by genetic lightning, and we didn't make it in time to help him. 50% of all rare diseases affect children, and 30% will not live to see their 5th birthday. That statistic is staggering. And this is what it looks like. This is the norm. I think it's important to let this picture just sink in a moment. And it truly is patients that drive treatment. We become honorary PhDs, MDs, we raise ludicrous amounts of money, we know our diseases more than anyone. Typically, we're educating the doctors in the room. But if patients were more involved from the beginning, especially in trial design, the success rate would be much higher. If you're a company in the audience, I really hope you consider the importance of including a chief patient officer to ensure the voices of patients are heard. Being a rare disease family is super, super tough. I heard a great Mike Tyson quote, "Everyone has a plan until you're punched in the mouth." And how true is that? The physical drain is enormous. Divorce is the norm, and it's not what you chose for your life or for your kids, but we dedicate ourselves to something bigger than us because we have hope for our children. I truly believe that the KPM group is a change agent in this ecosystem. I find Petrosky's quote, "Let's champion the voice and perspective of small pharma, the companies on the front lines of innovation in breakthrough science, research, and development, to be so inspirational." And in closing, I'm not going to stop until my miracle happens. I like to say I can be reached at any hour of the day to slay some rare disease. So if you'd like to connect and follow my story, that code goes to my LinkedIn. Don't hesitate to reach out. Thank you so much for taking the time to listen today, and thank you so much to the KPM group for giving me this opportunity.